Good morning, everyone, and welcome to Red Deer City Hall Park. My name is Adriana LaGrange, and I am honored to be the Minister of Education and the MLA for Red Deer North. And I'm so very pleased to be welcoming all of you here today. Thank you to all who are here joining us in person, as well as those who are joining us by teleconference. I'm also very grateful that the weather is somewhat cooperating with us today so that you can enjoy this beautiful park that's behind me. It's just gorgeous. While I might be just a little biased, I believe that everyone here would agree with me that Red Deer is one of the most beautiful places that you could possibly live, work, or raise a family. Yes. Today, I'm extremely pleased to welcome one of the hardest working people in Alberta, our Premier, Jason Kenney. As well, I would like to welcome one of my good friends and colleagues, the Associate Minister of Mental Health and Addictions, Jason Luan. They are both here today to join us to make a very, very important announcement, and I'm so excited. We're also joined here today by my fellow Red Deer MLA, Jason Steffen. He's the MLA for Red Deer South. And also we have Mayor of Red Deer, Tara Veer. We have a number of other dignitaries, which I'll point out right now. MP Blaine Calkins. And our city councillors, and I'll mention them all. Buck Buchanan, Michael Daw, Lawrence Lee, Tanya Hanley, Vesna Hyam, Frank Wan, and Ken Johnston. Welcome. So I want to thank everyone for being here. As I said earlier, this is a great city. This is a great day for such a great announcement. Without further ado, I'm going to turn it over to our Premier, Jason Kenney.
Thank you so much, Adriana, and thanks to all of you for being here. Your worship, thanks for welcoming us to City Hall, all the members of council, and we also have the Jason show here, 3 of us up here. You can never have too many. And great to see so many friends for an important announcement about recovery, about Alberta's economic recovery and job creation, but also helping Albertans to recover from the trap of addiction. During this COVID crisis, we have been focused on both protecting lives and livelihoods. That is so important. And we know that Alberta has been experiencing an addictions crisis, which is connected to a mental health crisis now for several years. Far, far too many of our fellow Albertans losing their lives to the destructive nature of substance abuse addictions. And we've also been, of course, living through several challenging years in our economy. Several years of economic stagnation and unacceptably high levels of unemployment. That's why our government was elected last year on a commitment to Albertans to make historic investments in an ambitious mental health and addictions strategy with unprecedented scale. With a $140 million commitment, even during really tough fiscal times, we've set aside initially $140 million to increase comprehensive support for folks challenged by mental health issues and battling the destructive nature of addictions. Then, of course, we hit the COVID crisis, the largest public health crisis in a century, the biggest economic contraction since the Great Depression, and on top of it all, the biggest collapse in oil prices in history for an economy that depends so much on our energy sector. This is a triple whammy, and it has had, all 3 of these things have had a real impact on people's lives. With, we think, a real unemployment rate north of 20%, with people struggling to hold on to not only their jobs, but their homes, their businesses, their livelihoods, and many people, unfortunately, because of all of those challenges, feeling a sense of despair that too often is expressed with mental illness and through substance abuse addictions. That is why, in the face of the COVID crisis and this triple whammy, our government further increased Alberta's investment in supporting the mental health of Albertans and in dealing with the challenge of addictions with an additional investment of $53 million for COVID-related mental health and addiction support. That, by the way, is more than the mental health support in the COVID crisis provided by all 9 other Canadian provincial governments times 2. That's the scale of our ambition. We are determined to be national and international leaders in providing mental health support to our people, and particularly those who are combating addictions, because we know the two are closely connected. Together, mental health and addiction constitutes one of the biggest and toughest public health challenges of our time. It's why we are determined to build a long-needed, province-wide, sustained and effective continuum of care that spans from prevention to treatment to long-term lifetime recovery. Now, some in the past have had a single-minded focus on only one approach, and that involved, in part, setting up drug consumption sites. Consumption sites that have had a very negative impact on local neighborhoods, on livelihoods, on jobs, on businesses, on crime rates, and that is why our government kept an election commitment to appoint an expert panel to assess the social and economic data of the impact of drug consumption sites. And they came back, this was a panel made up of addiction experts, people in recovery from addiction, people who've lost family members to addiction, academics, scholars, medical experts, and law enforcement and businesses as well. And they came back and underscored that there is real data demonstrating that many of the drug consumption sites around Alberta ended up creating significant negative damage on local neighboring communities, on the economy, with an increase in crime and in some places an increase in death in the proximate areas. That report uncovered financial irregularities at the largest drug consumption site in the province, which led to this week's shocking audit about the Arches consumption site in the city of Lethbridge, and has underscored very serious concerns about apparent financial malfeasance and, quite frankly, what appears to be some people profiting personally from the misery of others going through drug addiction. That is outrageous, and I condemn that behavior, and that is why the Government of Alberta has withdrawn funding from that organization and we have referred the findings of that audit to the law enforcement agencies to ensure that there are legal consequences for abusing tax dollars in such a terrible way on an issue so important as addictions. That's also why our government is determined to provide a real life-giving alternative, an alternative through a continuum of care, of effective treatment, leading to the ultimate goal of recovery, and that must be the basis of Alberta's strategy. Because some people deny it, but the data proves that recovery is possible, and we are selling Albertans coping with addiction short if we tell them that they cannot recover from the destructive impact of addiction. This is an indisputable fact. Tens of thousands of Albertans living in short and long-term recovery from addiction are living proof of it. They serve as an inspiration to all of us that this health challenge can be overcome and that there are effective, life-giving solutions. And those heroic Albertans who have overcome the trap of addiction come from every walk of life, from all of our communities, from First Nations, from all backgrounds, from rich and poor. And whoever they are, wherever they come from, their message to us is the same. Please build a community health response that is safe for the community and based in evidence of what works. And that is exactly what Alberta is doing. Now, I started by talking about the COVID challenge of protecting lives and livelihoods. On livelihoods, that's why 2 weeks ago we announced Alberta's economic recovery plan to build, to diversify, and to create jobs, with, in part, the single largest government infrastructure investment in Alberta history, the largest per capita in Canada, a $10 billion investment this year that will create 50,000 jobs, in addition to the other actions we are taking to bring investment back to Alberta. But that job creation infrastructure investment I announced will help to, yes, build roads and schools and hospitals, to build the architecture for our future economy, but it will also be invested in building recovery treatment centers for people facing addiction. Earlier this week, Minister Lewan announced an additional $25 million as part of Alberta's economic recovery plan to build 5 new recovery and treatment facilities across Alberta, adding 400 mental health and addiction treatment beds. And today, I am excited to announce that the first of these new treatment facilities, a 75-bed, fully equipped recovery community, will be built right here in Red Deer. Recovery communities, also known as therapeutic communities, offer long-term holistic treatment for people struggling with substance abuse, trauma, and mental health issues. This approach is being successfully used in 65 countries around the world, including as a central pillar of the internationally renowned Portuguese model. People who enter into recovery communities are given every opportunity and encouragement to take control of their addiction, to achieve sobriety, to improve their health, to reconnect with their loved ones. They rediscover personal responsibility and self-reliance, compassion for others injured by their actions, and the love of those who care for them. The recovery community experience is about far more than abstinence from drug use, although that is obviously essential. It's about confronting the realities of life, learning how to cope with them, and becoming a strong, fully functioning person. Participants advance through the stages of treatment at their own pace, assuming greater responsibility in the community along the way. But the goal is to leave the program not only drug-free, but also employed or going back to school. Recovery communities allow participants to heal and to take their rightful place in society as responsible, law-abiding, contributing citizens. This announcement today isn't just welcome news for people living with and suffering from addiction, it's also encouraging for those who endure the social impacts of crime and social disorder. This is all about compassion for those struggling with addiction. Some say we should just help to facilitate addictions. This is an investment in the message of hope, of recovery from addictions. To those struggling with addictions, you are our family members, our friends, our neighbors, and our co-workers. And we will do everything we can in this province to support you and to encourage you in your pursuit of recovery and a better life. I'm proud to be here in Red Deer, Your Worship, today to announce the first recovery community in Alberta. And I want to thank you and your council and your community and the many nonprofits and charities and faith groups for your support for helping people with addictions. And I look forward to our government announcing other locations around the province over the rest of the summer. So the message today is that treatment works and recovery is possible. And today, I love today's announcement because it is about matching economic recovery and job creation with helping people recover from addictions. So, Your Worship, Minister Lewan, let's get this thing done. Thank you very much.
Thank you so much, Premier. Good morning, everybody, and thank you so much for having me over here. Thank you, everyone, for coming today. I'm so pleased here with our Premier and my colleague, Minister LaGrange, MLA Stefan, and of course, Your Worship, Mayor Veer. Today is special. I want to begin by saying congratulations to people of Red Deer. Congratulations to Central Alberta. You're the first out of the gate of our revolutionary transformational change of changing the landscape of how we provide services to help people get out of addiction. So I know Mayor Veer and my two colleagues in Red Deer here worked very closely with my office to make all the tangible things happen so that today we can make this announcement. Thank you so much for that. Another part I want to highlight is part of the best practice of recovery community or therapeutic community is you work with your community, because it's a transformational change, not just for the person who are in recovery, but your family and the people that you're interacting with. Today's announcement is a great example of that community spirit. With the support of your mayor, your council, your local MLAs, and people of Red Deer, we quickly come to the agreement that we have a land in place. We have all the zones, every piece of policy that cleared. Then we can quickly get on to build the center here. As you hear from Premier talking about, this holistic approach is transformational for people's life change. This is one addressing the root cause of addiction and mental health issues. This is the one that people's life will be changed from the destructive addiction and mental illness into healthy living, drug-free, and becoming constructive and positively engaged citizens. I believe that's what people of Red Deer, people of Alberta has been looking for. Today marks the beginning of a change. So congratulations. For too long in Alberta, very unfortunate that we've been stuck with one pillar approach, or program existed on its own merit. You end up having a system of fragmented services. For people who want access service, they say it takes a degree to figure out where to find a service to meet your need. For people who want to help, they are frustrated. They don't see the connection here. I want to emphasize that credit to our Premier, who have the vision, have the leadership to show a province by creating a ministry I'm fortunate to be the first to work on, solely focused on mental health and addiction, and give the focus of recovery as the focal point. We're going to work on building a recovery-oriented continuum care. We're going to connect every piece of the current services that provided. We're going to examine how each of the service relate to getting people out of the addiction and into a healthy life. So it's going to be focused on recovery, focused on wellness. Can you imagine when we realign our system, when every piece of the work is connected and every one of them pointing to a direction that we're helping people getting healthier and getting out of the difficulty life they have? That is, ladies and gentlemen, the so-called Alberta model. I am so excited and so feel like so much privileged. I have the opportunity to work under leadership like that in the province, that we can do those transformational change. Once again, I want to congratulate City of Red Deer. You're the first out of the gate. I can't wait to see the center in operation. I can't wait to see the successful stories coming out of this, that when people start sharing how their life has been changed. And we can't wait to show the leadership across the province, across the country, that we're making a difference. So thank you again, and congratulations.
Premier Kenney, Minister Lewan, Minister LaGrange, and MLA Stefan, special guests, my community friends, thank you so much, everyone, for taking the time to join us in the heart of the city that we're so fortunate to call our home, in the heart of this great province that we're so fortunate to call our home. Thank you for being here to mark what is an important announcement, not only for our city, but for our region and ultimately the people of Alberta. I'm so pleased to be joined by my council team, and we welcome everyone to our historic City Hall Park today. My fellow Red Deerians and Albertans, our perseverance has yet again prevailed and transformed what was once only a possibility into our new community reality. First and foremost, on behalf of Red Deer City Council, the City of Red Deer, and the people of Red Deer, I would like to sincerely thank Premier Kenney, Minister Lewan, Minister LaGrange, and MLA Stephan and their respective staff members and colleagues for hearing us, and above all, fulfilling this long-standing, long-requested imperative for our community. Today is a good day. As one of my colleagues would say, today's a great day to be Red Deerian. And the Alberta government's allocation for a recovery community in the heart of our province will provide much needed support for people facing addictions in Red Deer and Central Alberta. Earlier this week, as the Minister and Premier mentioned, the Government of Alberta announced 5 recovery centres across our province, and the City of Red Deer is proud to be designated as one of them. Over the past decade, our community has often publicly noted Red Deer's desperate need for residential treatment to support individuals and families affected by addictions. The health and social consequences of this long-standing need have become tragically evident in our community, reaching an absolute crisis point over the past couple of years. While insufficient treatment options has been a systemic challenge in our city and region for years, the national drug crisis has further escalated the consequences of this fact for our community. The national drug crisis, which is most certainly a local drug crisis, has unequivocally had devastating, life-altering circumstances for many people of our city. This devastation compelled our community to convene a few years ago because the tragic consequences of the status quo were unacceptable. The result of our community's decision to respond together was the commission of a community and drug alcohol strategy, a catalyst which initiated our advocacy and today's partnership with the provincial government to address what had emerged as a clear health and social deficit in Red Deer, an effort which our community has sustained over the past couple of years. This community need has shifted in what was previously a health and social infrastructure deficit into an overt addictions and drug crisis, exacerbated, as was mentioned by our provincial leaders, by the continuing recession and mental health crisis that have made individuals and families living with addictions even more vulnerable. Today, however, marks an important step towards resolving some of the health and social challenges that our community has contended with for many, many years. This recovery community means that we are now positioned to build systemic solutions in the interests of the people we jointly serve. Residential treatment will not necessarily solve every health and social problem that we are facing, but today's announcement will resolve many community concerns that we've only been reacting to, and it will most certainly make a difference for the individuals and families who are so deeply affected by addictions. To close, I'd like to again personally thank, on behalf of our council, Premier Kenney and Minister Lewan, who have made themselves personally available to our community and for your responsiveness to our community's long-standing plea. Thank you to Minister LaGrange and MLA Stephan for elevating our community's call for addiction residential treatment in Red Deer. Our societal addictions response should be about people and our willingness to prove that we believe there is hope for people living with addictions. We look forward to working with the government in the coming weeks And above all, I want to remember community friends and loved ones who are not with us today for this announcement. And I would like to name a few by name. A recovery community like this may have meant that people like Martin, like Maddie, Kimberly, Jill, and Sadie. Some of them were kids, some of them young adults, to name just a few, and I know that there's so many more names, would be here to mark this day with us. We dedicate this project to their memory and to our fellow community members who are like them. And we hope that this recovery center, and we trust it will, prevent further tragedy. Thank you, Premier. Thank you, Minister.
The mayor is right. Today is a good day for our city. Red Deer is blessed with many natural advantages and, most important, great individuals and families. In the election last year, one of the main issues in our community related to drug addictions and their devastating consequences on our businesses, families, and social fabric of our community. There was a lack of vision, and our community suffered for it. Addiction is a challenge of human nature. Success in this complex matter must begin with the end in mind, supporting and loving our neighbors seeking to become free from addictions. It is that vision that directs this government's actions. Thanks to our Infrastructure Minister, Prasad Panda, and our good civic leaders working together behind the scenes, allowing this to occur. Most of all, thank you, Premier and Minister Luan, for your vision, coupled with action, for this game-changing announcement directed towards loving and supporting our neighbors seeking to become free from addictions. This principled course correction will not only bless our neighbors suffering under addiction, but also their families and communities throughout Central Alberta. Thank you very much, and better days are ahead.
All right, thanks everyone so much for being here today. We'll now move into a Q&A. We'll start with just reminding the folks on the line here to press *1 to join the queue. We'll grab some questions from the floor here today. There's a microphone provided.
Kalisha Mendonça with Sunday 94 and Lacombe Online. Your government continually mentions the Portuguese model. So Minister Luan or Premier Kenney can answer this. You continuously mention the Portuguese model, but you're missing one of the key pillars, which is decriminalization, which our police chiefs have now called to support. Where is this in your model of continuum of care?
Well, first of all, there is a widespread misunderstanding about the Portuguese model, which your question reflects. The reality is that there are legal consequences for people in Portugal who are arrested because of possession if they do not comply with alternatives. In fact, our government agrees with that approach, which is why we are expanding, as one of our platform commitments, alternative drug treatment courts. Minister Schweitzer has made announcements about additional money that is going to the establishment of greater access around the province to drug treatment courts, and we'll be pursuing other alternative forms of sentencing arrangements. Practically, what does this mean? Like in Portugal, if somebody is found or is accused of having violated the prohibition on illegal narcotics, they will have an alternative if they're committed to go into a treatment program, for example. So that is actually very similar to that central premise of the Portuguese model.
Just add to Premier's comment, 3 weeks ago we were here. Minister Schweitzer and I announced the increased funding for drug treatment court in Red Deer. So your double congratulations on that.
Yes, I was also present for that announcement, but still it's only based in abstinence-based recovery. Where is the compassion for people who are not ready to be not using drugs?
For a second time, I disagree with the premise of your question. I don't think there's any compassion in telling people that they do not have moral agency. There is no compassion in telling people that recovery really isn't possible for them. I think there's not much compassion in facilitating the destructive nature of drug addictions. There is great compassion in offering a holistic alternative, which is exactly what we're doing here today.
Okay, we will jump over to the phone lines here.
Can I get one question?
Sure thing.
Mr. Premier, Christian Khan, Global News. Kind of a two-part question. First off, you talked about Lethbridge. What is the province's plan now moving forward with Lethbridge? Are they considered as one of the recovery communities? And also, can you comment on the anti-mask rallies taking place throughout the province tomorrow?
So the expert panel on the drug consumption sites heard evidence of financial malfeasance in the Arches drug consumption site in Lethbridge. That's why Alberta Health contracted Deloitte to engage in a comprehensive audit of the finances around Arches. And as we now know, there have been shocking revelations about potentially illegal, even potentially criminal financial malfeasance around the operation of that centre, which I think went from something like 8 to over 100 employees. It involves international travel with family. It involves gift cards. It involves, I think, $1.5 million, which has frankly gone missing. This is frankly reminiscent of a similar fact pattern uncovered in British Columbia, in Vancouver, with the Portland Hotel Society a few years ago, where we had the executives of a nonprofit that was supposedly focused on harm reduction, flying around to Disneyland with family, executives making massive salaries, hundreds of thousands of dollars, unaccounted for expenses. So this is a very serious problem, and that's why we referred it to the police for potential further criminal investigation, and it's why we immediately withdrew funding from Arches. We appreciate the Government of Canada's commitment not to backfill that funding, and we will ensure seamless access to services. We'll have announcements to come in the future about additional treatment services in the Lethbridge area. We've been working also very closely with the neighboring Kenney Blood First Nation Reserve on assisting them with additional treatment and recovery services. I know that my friend Chief Roy Fox of the Kenney Nation was very concerned himself about the Arches operation and what it was doing to his community. So we've listened to Chief Fox, we've listened to the local community, we've listened to the auditors in removing that funding. But as I say, there will be seamless services, and Minister Lawan, I understand, will have an announcement to come on that in the days to follow. In terms of the, I wasn't aware that there are anti-mask rallies. What can I say? Look, Alberta has done well in combating COVID by focusing on personal responsibility rather than micromanaging people's lives. We had the least severe public health restrictions in Canada with, until recently, some of the best public health outcomes in the Western world. Unfortunately, we've seen a growing number of new cases. Fortunately, very few of those are ending up in hospital and even fewer in ICU admissions. But the huge outbreaks, the second wave that we've seen in many U.S. states and other countries demonstrates that this thing is still here. The virus is still a challenge. And all it takes is the exponential growth of a highly infectious virus of this nature for it prospectively to come back and overwhelm our healthcare system. And I would much rather that we prevent that through the widespread use of masks to prevent the spread, rather than the government bigfooting in and suspending the operation of all sorts of businesses that would have massive economic and social consequences. So my pitch to those folks who are up, look, if they're upset about mask usage, then the alternative will inevitably be more widespread suspensions of economic activity if we get a second outbreak. So I think the responsible exercise of personal freedom through mask usage, where people cannot physically distance, is a lot better alternative than suspending businesses or social activity. So I would also, like, when I look at Facebook, I hear people say that mask wearing is a globalist idea. I will remind them that I was advocating mask use when the World Health Organization, a global organization, was recommending against it. And Alberta is trying to help people with widespread mask usage where they cannot physically distance by providing 40 million free masks. We're the only province in Canada to do that, and we're providing some to the city of Red Deer, and through Red Deer, for example, to transit, to faith communities, etc. So I'm sorry that wasn't a good soundbite. So let me try to give you one. Mask use is scientifically proven to limit the spread, especially where people cannot physically distance. It is strongly encouraged by the medical experts and by the government, which is why we're making them available for free. And it is better that people use masks rather than potentially forcing the government in the future to shut down aspects of our economy.
Thanks very much. Operator, can we please put through the first caller?
Our first question comes from James Keller of the Globe and Mail. Your line is open.
Hi there. Speaking of COVID, I'm just wondering, when we look at the statistics per capita, Alberta is leading the country in new daily cases. I think we're second to Quebec in hospitalizations. There's a lot of metrics where we're at the top or near the top. Are you concerned that Alberta is becoming a COVID-19 hotspot? And what do you think needs to happen to turn that around?
No, I'm not. We're not a hotspot. We have, I think last count, 13 people in ICU admissions with COVID-19. We are concerned to see growth in new cases. They are in relative terms. If you look globally, still the number of active cases is very small, but it should be a wake-up call and a reminder to Albertans that we are not done with COVID-19, that it continues to pose a very serious threat to public health. And that is why we, once again, ask people to very carefully follow the public health guidelines. I am proud of Albertans in that we've managed to get to this point with amongst the lowest level per capita of infections, hospitalizations, and COVID-related fatalities of the large Canadian provinces, lower than in, I think, all of the U.S. states and in amongst the European countries. And we've done that really by emphasizing public education and personal responsibility. I think that perhaps because the numbers were so good in this province, that some people let down their guard. And certainly one thing that we have seen in some of the recent minor outbreaks is they involve very often socializing amongst younger people. The average age of new cases has tilted increasingly to a younger population. The good news is that the novel coronavirus poses a infinitesimally small health risk to healthy young people. The bad news is that the more young people who have the infection and who may not know it, who are asymptomatic, can be unwitting vectors of transmission. They can spread it to people who are more vulnerable. So our message to younger Albertans in particular, who may think that this thing is behind us, is that without them realizing it, they may end up jeopardizing the health of their grandparents, of elderly people, of the immunocompromised, of folks with multiple chronic conditions. So it's very important that we take note of the new cases that are happening, and we just ask Albertans to please demonstrate the same kind of personal responsibility that the vast majority of people have over the past 4 months.
Thank you, Premier. Operator, can you please put through the next caller?
Our next question comes from Rob Drinkwater of the Canadian Press. Your line is open.
Yes, for the Premier, you say recovery is possible, but supporters of consumption sites say you can't recover from being dead. So much research shows that consumption sites save lives. Why not replace the leadership of Arch's consumption site in Lethbridge instead of withdrawing the funding?
I think they already did that. By the way, there was another internal audit about total dysfunctionality happening within the management of that organization. This is a very, very serious audit. And again, it reminds me of the Portland Hotel corruption in Vancouver. And in terms of the evidence, I'll refer you to the expert panel on the social and economic impact of these places. Here's the reality. In the past, there has been a single-minded focus on one approach, and a complete lack of commitment by the provincial government in the past to a continuum of care approach. And so what we're focused on through unprecedented investment is ensuring immediate access is available to detox facilities, and then a seamless transition available to residential treatment facilities within therapeutic communities. That means long-term treatment, not just in and out over 2 or 3 weeks. It means a really holistic long-term residential treatment community. And then that there are robust support available for lifetime recovery programs. These are the proven most effective ways to help people get out of the trap of addiction, and that's why we're pleased to be partners with the City of Red Deer in moving that forward in Central Alberta.
Perfect. I think we have time for one more caller today, so can you please put through the final caller?
Our final question for today comes from Leanne Falder of the Edmonton Journal. Your line is open.
Hi. Thanks very much for taking my call. The comments today reflect the fact that most people would know what the Portuguese model is, and I don't know what the Portuguese model is. So I'm wondering if you can describe the model and describe who will deliver the model here in Alberta, and will it be a publicly based model or a privately based model? But more interested in what is the model and who will deliver it here.
I can help respond to that Portuguese model. Last year, there was a provincial conference for a recovery. I was there, listened firsthand from the expert from Portugal. They talk about that model. That model is very much similar to what this government is currently talking about, the full continuum care. So it's a multi-pillar approach. Law enforcement is one of the key components there. Premier already talked about that. There's those people who sort of took the Portugal model and twisted a little bit to their like, and in reality, that's not what the Portugal model is about. The expert talked very clearly at the conference that I was attending. Yes, they decriminalized drug usage, but they significantly increased the administration penalty for that. So you still go through those civil court, and you're given options whether you will be held to account for hefty fines, or you're giving choices to community services or treatment, like the drug court program that we adapted here. So the response that we're doing is really taking on the best practice across the whole globe and apply that into Alberta sort of context. So that's what we're doing here.
Good job. Thanks very much today.